very learned Professor Erwin Sperber. Want me to keep going, Erwin, or you?
No, you'll get paid later. To begin with, Kevin Cahill was one of the very first students I ever had when I arrived at SUNY New Paltz in the 70s. You were there, right, Kevin?
That's right.
Yeah, and he was a first-rate student then, and you could see that the terrific liberal arts education he got paid off very nicely. And that's
Erwin,
why
I'm sorry to say you're out of time. Thank you.
Goodbye. Okay. Why are we here, really? It's because a few years back, the Berger Commission, which was a creation of the state legislature and different sectors of the healthcare community, came to the conclusion that there were so many hospitals that were in fiscal trouble that they would need either to shut down or be put through forced mergers. That included not only what you good people have seen here in the Mid-Hudson so far as the problems relating to Kingston and Benedictine, but some of the finest public university hospitals, some of the SUNY hospitals, were also being immediately and gravely threatened at the time, and they too would have been shut down and wiped out, but for the fact that we have, fortunately, a powerful faculty union that raised the roof about it, and that helped to turn the tide of battle, at least for the time being. What I want to get to, folks, is that a lot of the problems we're struggling with now really are imposed upon us by corporate forces that you don't see in action. All you see is the impact and the disasters facing a community like ours. It's really ultimately the health maintenance organizations that have been truly rolling in money. They don't know what to do with their enormous wealth, so what they do with it is give a whole lot of it to members of Congress, some members of the state legislature, who are willing to allow the HMOs directly and indirectly to dictate the levels of reimbursement that Medicare and Medicaid will provide for hospital services, particularly including the most expensive kinds of things such as emergency care. So these are not just narrow technical bureaucratic decisions when Medicare and Medicaid don't want to provide the necessary and more adequate levels of reimbursement that Kingston and Benedictine Hospital need in order to maintain their fiscal solvency. Supposedly, you see, the HMOs follow the pattern of reimbursement set by Medicare and Medicaid. In reality, because of the immense power politically and ideologically that the HMOs have over the entire healthcare system and over so many key congressional committees and insurance commissioners all over the country, including, sad to say, New York State, the simple fact of the matter is that you have the tail wagging the dog. And so while we sit and bemoan the fact that Kingston and Benedictine show all this red ink, the HMOs are not by any means suffering. Their stock dividends, their shares steadily go up in value. And to me, it's a crying shame to see a lot of caring and concerned Roman Catholics and other people with fundamentalist views, which I don't agree with at all, but I respect their views, and the folks who are secular and do believe in abortion fighting with each other, because ultimately, whether Benedictine becomes a hospital that provides full reproductive services, or the cardinal goes through with some kind of legal action that he's threatening, who knows what he's really going to do, if anything. But the fact is that all that's going to happen if Benedictine becomes the only hospital in the community, rather than having Kingston alongside of it, is that the rate of hemorrhaging is simply going to slow down a bit. But Benedictine is also going to be ultimately doomed unless and until we force Congress to turn the tide and to make sure, absolutely sure, that incredibly expensive services such as emergency care, or emergency room physicians are very, very much in demand. They are very highly trained, and it's very expensive all around, up and down. Everything in open heart surgery, all kinds of surgery nowadays is incredibly expensive. I can personally testify to that. Just a couple of months ago, I had a total knee replacement operation, and I was just shocked at the costs. Thank goodness I don't have to pay most of it because I have a good health insurance policy. But most of us, most of the time, find that the HMOs kick us around. And what I am proposing, and I've sounded off about this before, and I guess I've never used plain enough language to galvanize the interest of you good people here. You all need to bury the hatchet, get together, and figure out how you can push the Commissioner of Insurance, how you can push every single member of Congress, not just in this newly formed 19th Congressional District, but all the other adjoining congressional districts, to get together and finally come up with a solution to this problem, because there are too many hospitals in New York State that have, fine hospitals that have wound up in the same god-awful situation. And so you have to get together. I will be glad to work with you. I'm sure Assemblyman Cahill will. And, you know, just one very quick comment I want to offer here. You will take note, I hope, of the fact that neither one of the two congressional candidates, the Democratic candidate or the Republican candidate, are here today. They don't have any representatives here, and they simply want to shut their eyes, for the most part, from everything I can see, to the gravity of the situation that is truly going to impact this community very badly, because too many people are going to be out of work, and the economy in this region is already extremely fragile. Thanks.
Hear, hear.
I didn't hear a question, and I think that's fine. I think